to further demonstrate the concept of essentially trying to differentiate between structures, so to go from a macro assessment to a micro assessment. So macro identifies micro, will allow me to identify the area that I need to look closer to, such that if I find the area that I need to pay closer attention to, and I need to attempt for some reason to figure out which structure is most at fault or most restricted rather, then I can do it by isolating things. So if I do a conjoint macro test, such as a straight leg raise, and to simulate it, I see something like this. I see a knee that will not straighten out. Hip will go to 90 degrees, but knee won't straighten. Now I can do two things. I can do a conjoint treatment, so I can just go ahead and go straight into something with an assumption that I need to work on the hamstrings, or I can choose to attempt to pick things apart and identify the structures around the knee that are worth further investigation to see if one of them happens to be a little bit more at play, right, or more restricted than others. The most obvious culprit in a situation or simulated situation like what I showed would be the hamstrings themselves. But to be thorough, what I would do is I would check all the soft tissue. So to check a soft tissue, you can have it in any position, but because the patient's in supine, I can check the quadriceps, right? So moving perpendicular to fiber direction. Why would I check the quadriceps? There are some clinical scenarios that I have identified whereby the knee won't straighten all the way, and yes, the hamstring is somewhat involved, but I have had concomitant findings in the quadriceps, so I'm going to check them because I have that previous experience. Check the patella, right? I would then check in through the gastrocs, right? So I can hold here, perpendicular to fiber direction, check the gastrocs. Same deal with the hamstrings, perpendicular to fiber direction, right? I can check the hamstring. This is obviously somewhat cumbersome in that it's harder for me to get a full range, but I've got good contact, so contact control, pull, so hold the bone still, move the soft tissue across. Another way to check the hamstrings would be to essentially shoulder the leg, palpate the hamstring, and try to straighten it out, right? Try to straighten it out in different positions, but now because I can palpate that, so using good contact again, this is not the most ideal way to do it, but good contact or reasonable contact, palpate through. Then I can also, it's not going to be perfectly visible, I can check the fibula. So essentially I take a pincer grip, stabilize, so shin hits me in the abdomen, and then essentially what it would look like is something like this. So hold everything still, and then try to move the fibula, identify if that's a deal. I can come into the tibia, relatively speaking, so essentially stabilize the femur with the yoke hold, move the tibia on the relatively still femur. I can do drawer tests. If I'm getting a knee that won't straighten all the way, I don't expect that I would have ligamentous issues. I do expect somewhat it would be more muscular, right? So this is just trying to say or show I go from the macro test, right, the relative macro test, to relative micro tests where I have to separate things, to dissociate things, or to isolate things in order to see which is most at play or most restricted. I can treat in a conjoint way. As I said, I just go straight to treating the hamstring, so I make an assumption, or if I feel there is a reason to isolate it, I can do so. I'm showing it in supine because it's fairly easy to go from the macro test to the micro test. If I was really trying to test the hamstrings, I would probably do it in prone. However, for the purpose of this video, I'm just going to do this all in supine. So again, I have my macro straight leg raise that I separate into the varying structures, right? So quadriceps as a soft tissue, hamstrings as a soft tissue, the gastrocs as a soft tissue, the fibula, the tibia, and I've already checked the joint in the macro test, right? So I isolate them, I identify which is most at play, and then I would make a treatment choice.